Do you know what happens during a root canal procedure? Often, the mere mention of a root canal can spark fear or anxiety, but it doesn't have to be that way. A root canal is a common dental procedure performed to save a severely damaged or infected tooth. You might need a root canal if you're experiencing severe tooth pain, prolonged sensitivity to heat or cold, discoloration of the tooth, or swelling and tenderness in the nearby gums. The procedure involves several steps, including preparing the area, accessing and cleaning the roots, shaping the canals, filling the canals, and if necessary, adding a crown. It might sound complicated, but it's a straightforward process when broken down step by step. And most importantly, it's a procedure that can alleviate pain and save your natural tooth. So let's delve deeper into each step of this procedure. Firstly, the dentist prepares the area for the procedure. To ensure a comfortable experience, the area around the affected tooth is thoroughly numb. This crucial step is achieved through the use of injections, delivering a numbing agent directly into the gums and down to the tooth's root. This is done with the utmost care, providing a buffer between you and any potential discomfort during the procedure. Once the area is comfortably numb, the dentist then places what is known as a dental dam into the mouth. This ingenious tool isolates the tooth that requires the root canal, effectively covering and protecting the rest of the teeth in the mouth. The dental dam provides a clean and secure environment for the dentist to work in, ensuring that the focus remains solely on the tooth in question. With the area prepared, we can move on to the next stage, accessing and cleaning the roots of the tooth. The next step involves accessing and cleaning the roots. This is where the magic happens. The dentist, with a steady hand and precision, drills through the tooth. This is not just any drilling, it's a calculated process that allows access to the root canals and pulp chamber. This might sound like a complicated process, but it's all in a day's work for your dentist. Once the dentist has access, it's time to clean. The pulp chamber and root canals are thoroughly cleaned using specialized instruments. This is done meticulously to ensure that every nook and cranny is reached. Following this, an antibacterial and antiseptic solution is introduced. This solution is a cleaning superstar, ensuring that the canals are not just clean, but disinfected too. This is a crucial step as it helps eliminate bacteria and treats the infection nestled within the canals. Once the area is cleaned, it's time to shape the canals. The shaping of the canals is a crucial part of the procedure. It is at this stage that the dentist prepares the canals to receive the filling. Using tiny, specially designed instruments, the dentist carefully shapes the canals. The goal here is to create a smooth and clean pathway that will allow the filling material to be placed effectively. This process is meticulous, as the shape and size of the canals can vary significantly from tooth to tooth. It's a bit like custom tailoring. Each canal is shaped to fit perfectly with the filling material. The shaping not only prepares the canals for the filling, but also ensures that any remaining bacteria, debris, or infected pulp is thoroughly removed. Once the canals are shaped and cleaned for the second time, they are ready for the next step. After shaping and cleaning, we proceed to fill the canals. Filling the canals is a meticulous process. It's a step that requires precision and care, much like a skilled artist working on a delicate masterpiece. The dentist, now armed with a material called gutta percha, prepares to fill the canals. Gutta percha is a rubber-like substance, and it's chosen for its durability and its ability to conform to the unique shapes of your root canals. Picture in your mind, if you will, a sculptor working with clay. The gutta percha, much like the clay, starts off pliable. It's gently placed inside the canals, filling up the space that was once occupied by the infected pulp. But the work doesn't stop there. The gutta percha is then heated, causing it to soften and expand. This ensures that it fits snugly against the walls of the canals, leaving no room for bacteria to sneak in. Now, if you've ever baked bread, you'll know that dough needs to be compressed to remove air bubbles before it's ready to bake. Similarly, the dentist compresses the heated gutta percha. This gives it a tight fit, ensuring that every nook and cranny within the canal is filled. But there's one last step in this process. The dentist adds a layer of adhesive cement. This acts like a sealant, providing an extra layer of protection. It's like putting a lid on a jar, keeping everything inside safe and secure. This well-sealed canal is now ready to take on the world, or at least the daily rigors of chewing and biting. However, remember that hole we talked about earlier? The one made to access the canals? Well, it too needs to be sealed. This is crucial, as it prevents bacteria from entering the tooth from above. In some cases, the dentist might need to place a post in a canal to strengthen the tooth. This is especially true if the tooth is severely damaged and cannot support a restoration on its own. With the canals filled, the access hole must also be sealed. The filling process is now complete, and we're one step closer to a healthier, happier tooth. After the procedure, the healing process begins.